They're the ones who raise the bar. The ones dedicated to providing care in the most demanding of circumstances. The ones that understand the healing benefits of kindness and compassion. They're the people of Sarah Bush Lincoln, and they set the bar high. Sarah Bush Lincoln, trusted, compassionate care right here close to home.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
Carle is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carle, with Health Alliance, is always at the forefront to help you thrive.
Good evening, and thank you for joining us for this edition live Being Well, the Pandemic Panel. I'm your host, Lacey Spence, and I am so happy to be sharing the WEIU studios live this evening with four fabulous doctors. I will go ahead and let them introduce themselves. We will start on the end with you.
Good evening, Dr. Bill Elliott. I'm a clinical psychologist at Horizon Health in Paris with operations in Kansas, Oakland, and Chrisman and Marshall.
Hi, my name is Bob Healy. I'm an internal medicine physician, and I'm at Carle Health, and I'm up at the Urbana Carle Foundation Hospitals, where my offices are. And yeah, very nice to be here.
Hey, good evening. I'm Dr. Ryan Jennings, and I'm privileged to serve as the Chief Medical Officer at HSHS facilities at St. Anthony's in Effingham, Good Shepherd in Shelbyville, and Holy Family in Greenville.
My name is Jeremy Topin. I am a pulmonary and critical care physician at Sarah Bush Lincoln Hospital and medical director of the ICU.
Wonderful. So we've got a lot of backgrounds represented here this evening, and we are hoping that our viewers will call in and pick their brains. So how this evening will work, we have the phone number at the bottom of the screen at this moment. We've got 1-877-727-9348, and that number is also on our WEIU social media. And so for the rest of this hour, the floor is pretty much yours. I've prepared a little background questions, just waiting on your phone call. So we hope that you will call in. We've got people standing by to answer the phones, take down those questions, they'll pass them on to me, and then we will pose them to the panel. So to jump right in and get started, I think we should start with all of your perspectives as the pandemic was unfolding. Just what did things look like? How did situations unfold? What do you remember? We'll start with Dr. Elliott.
Well, I think what stands out to me is the impact on children and adolescents. The incredible disruption in routines, school, of course, being the main one, the adjustment by students and teachers to switching rapidly to online instruction. And I just think that here we are 2 years later, and kudos to kids for having made the adaptation, but also particularly to teachers who really were underappreciated perhaps then. I hope they're more appreciated now, but that stands out to me from the outset.
The resilience, for sure.
Absolutely.
Dr. Healy?
Yeah, it's a great question. A lot of things going through my brain, but I think at first fear. You know, everyone was afraid. Physicians, our nursing staff, our other teammates in healthcare, afraid for our community. I'd come home and answer questions from my family who were afraid. That, and then the ever-changing information that would come out. Mm-hmm. So we would say one thing one day, and then we'd learn something else, and then have to say something different the next week or the next day. Those are the things that come to mind.
Dr. Jennings?
I would have to echo that. The very first thing was fear.
Yeah.
You know, in my family, 3 of the 4 of us work in healthcare, and you know, we came home after things were really starting to heat up and had a meeting. They're adult, and said, "Do you going to continue to work in healthcare?" type conversation. This at that point they're talking about a 15% mortality rate, and I'm sitting there as the person who's saying that, well, if you do get sick, you won't have a visitor. And very difficult conversation. Thankfully, everyone said, no, I want to be part of this, and continued to step up. And within the organization, as they came back and then tried to kind of work with physicians and our teams to keep the momentum going around it, it was amazing how quickly it shifted from fear to innovation and you know, just thinking about a problem differently. And so it was quick pace, to say the least, but definitely the very first thoughts were just fear.
Yeah, you know, very similar as well. My experience was very ICU centric and dealt obviously with the patients that were on the extreme end of the severity of disease, and it's hard to forget what our unit went through and what the community went through in the ICU. Things were changing in terms of best practices and how to best care for these patients, but knowing that the majority of patients, once they're on a ventilator, we're not going to have a good outcome. We're going to most likely die, and not having family available to be advocates and care and support, and the added burdens of communication with family that's distant and not seeing what we're doing, and that challenge of building trust was a new dynamic in an ICU setting, and just the volume and acuity that all of our ICUs, you know, around the country had to quickly step up to and sort of innovate our way to kind of figuring out a lot of problems on the fly. That's going to really stick around to I think all of us for a long time.
And you all have brought up a very good point. You've kind of launched into something I want to talk about. I would like to say that at this point, for what we have experienced, we have passed a peak, at least. During the peak of your respective fields, what were conditions like? We can start with you. I know you were saying, you know, ventilators and the stress on your healthcare system.
You know, the peak for us at Sarah Bush, I mean, you know, we have a 9-bed ICU. On a busy day, we'll have the ICU filled, maybe 2 or 3 patients on ventilators. We had, at one point, 16 patients on ventilators all at the same time, some on the floors, struggling to find rooms. Staffing was a challenge to make sure that all the patients adequately had the care that they need. It's very intense bedside care. So the ability of the hospital to kind of step up, try to figure out ways to do the best we can with the resources we had was kind of impressive, but something that just added a burden of stress on everyone. It's interesting now that times are much slower in the ease, and I look around at the staffing, and it's a shame to see how much staff has moved on. I mean, how many nurses have left the unit, how many nurses have moved on to other environments, because I think the burnout and the intensity of that, I think people are still, we're really all feeling the impact of that. I'm going to feel that impact for a long time.
At its peak, you know, I think the patient volume was part of the struggle, of course, as you would expect. And you know, when you're looking at hundreds of people across our health system that were in the hospital concurrently, but at the same time, especially pre-vaccine, the workforce was still getting COVID at a certain pace. And so we would be having large numbers of employees out at the same time. Now, post-vaccine, that world looks a little different. But early on, in kind of the thick of it, you not only had increased demand just from volume, but you had decreased ability to take care of it because your staff was sick. And of course, you care for those folks and want them back. We were fortunate because of being kind of part of a health system, but even nationally, the national stockpile resources and being able to move resources within our own health system and things like that, so that we didn't run into a lot of major shortages. It got pretty spooky at times. We had some fabrication done to create masks and things locally, you know, with local contractors, so that we could maintain that supply. So again, lots of innovation, but thankfully, you know, I think everybody prevailed, and I would echo the concerns of the loss in our healthcare workforce. Many people opted for a new career.
Dr. Healy?
Yeah, a couple themes. I think the innovation, just, you know, our community making masks at first when we didn't have enough masks, and they could use it, we could use it, visitors could use it when we still had visitors. I think, you know, one of the things is I mentioned fear earlier. Also, you mentioned how our staff, our colleagues were getting sick, and that's really, you know, that really affected us, right? Because they're people that we work with every day. I think we all were able to keep our people safe, though, with the proper PPE or personal protective equipment. But it did get scary at times with not having what I thought would be enough, but our staff always came up with the right amount and always came up with the masks when they needed that. But it was some scary times.
And then from your perspective, I mean, did you see a volume of patients dealing with, I mean, mental health was huge.
What I saw was, sadly, was an intensification of pre-existing mental health issues. Where there was domestic violence, it rose dramatically. Where there were substance use issues already present, they got worse. Where there had been histories of trauma, the experience itself was traumatic and then re-traumatizing for many people. And I think the most disturbing thing was seeing that older children and adolescents for whom suicide rates, suicidal thinking, and what we call non-suicidal self-injury, which is self-mutilation and other self-injury as an anxiety coping mechanism, all of those soared. And you know, that was a tough time across the board, and mental health was no exception.
So as you guys had kind of talked about watching the information, the flow of it, how quickly it came in, how quickly it was to change, really experiencing kind of the scientific method in real time. How was it trying to communicate that information to patients, at least from a media standpoint? I feel like there might have been a little bit of a divide where folks were, well, we believe the data and we can't trust the data because it's changed again. How did you kind of instill some confidence in best practices?
Boy, you know, speaking to, again, in the ICU when patients were their sickest, and some of that distrust could foment a lot as patients are getting worse and not responding, as many don't, to our therapies. It was a challenge. A challenge to, you know, try to explain, you know, why medications aren't appropriate, medicines like ivermectin and other remedies versus medicines that we had that there was some evidence. I mean, I think there's been two levels of that challenge. One is just the information that's out there that we know was good, the efficacy of vaccines, efficacies of certain medications, and battling that. And then in the unit itself, you're talking about the scientific method, how do we best treat these patients? You know, the truth is, the scientific method takes time.
Yeah.
And the good data and the good evidence, while we were in the middle of it, wasn't out yet. And in some ways, if we're waiting for the hard science to come out, we're going to be way behind the curve. And I think it was a challenge for all of us to figure out what is best practice, and a lot of communication with other peers and colleagues, and trying to be on the forefront of things, and yet we're still behind the science. And yet still have the trust of the families and the patients, and be open and honest about that. That dynamic does not happen that often in medicine, and it really it was another big stress point for the system.
Tiffany, the rest of you. Yeah, Dr. Healy.
I don't know about you, but my ICU colleagues social media worked well. because they were online. They were talking to people in Italy
Europe, yeah.
when it was happening at a real fast pace, people in New York when it was happening, knowing it was coming here, people in Chicago, and then it eventually hit us. But I think there were a lot of good things that were spread by social media back then.
Definitely a tool to be used, but also to be cautious with. A lot of things we jumped on the bandwagon early, months later wasn't, and that's a problem when you're trying to build trust. When something you said 2 months ago is not applicable now, and that is part of the scientific method of iterating and improving. And I think that's hard for a public to understand, especially when they're getting a lot of mixed messages on social media as well.
Yeah, no, it's definitely a two-edged sword, social media.
Well, speaking of a double-edged sword, one of the striking things was having kids come in those who were using social media for maintaining connections with peers and friends actually fared better psychologically. But if the kid was using it as his or her primary source of information about it, it was a disaster. And unless they had a strong relationship with a parent or sibling who could say, now listen to the science, don't listen to this stuff, that was an uphill battle that I don't know that we really ever surmounted.
Well, I think the thing that is, it's not over. And we're still on the front end of understanding long COVID and the long-term consequences physically, emotionally, et cetera, of this disease. And same problem, exactly the same problem. There's a little bit of information here and a little bit of that and a little bit of that. And the process hasn't had time to bear itself out to tell us what the truth is. And so we're going to be in the same process of trying to explain things to the public as we deal with this, without really knowing the truth, because we just haven't had the time, and very frustrating.
And pardon me if it's a silly way to ask it, but I feel like when we have a seasonal flu, you're able to kind of pinpoint that maybe these are what the symptoms are. But it felt as if the variants were coming out so quickly, and then you've got Jim over here who's asymptomatic, you've got somebody who feels like it's allergies, and then other people, they're landing in the ICU. Did you have a difficult time trying to explain that to patients and work that out?
Yeah, I think it was definitely a tough thing to talk about because, people get GI upset and they call and say, what do you think this could be? The answer was always, well, it's COVID until we prove otherwise, so get tested when the testing was available. But yeah, there was such many and varied symptoms, and the new variants would cause a little bit of a difference, a sore throat as opposed to what might have happened the variant before. So. I think part of the confusion of that happening was, the trust. You told me before it was X, Y, and Z, and now you're telling me it's this. Why is that? And of course, it's just because of the nature of the evolution of the virus.
And even in the same household. I mean, you've got husband and wife, and one sneezes twice and the other one's on a vent.
Yeah.
And how do you explain that? And other than just human character, and and maybe they had some comorbidities, maybe they had some other reason why they got sicker, but there was no doubt that this particular virus put itself out in an enormous spread of symptoms.
And I think one of the challenges early on was that most people didn't know someone who got sick, and so to hear it was always someone else, or it's not going to happen to me. And I think that was a big challenge early on in trying to convince people to get vaccinated, and they're sort of balancing their perceived risk of vaccine, which are very safe, versus the risk of getting severe COVID. I think, though, that after now 2+ years, I think in Coles County, it is a little bit of an easier sell, because I think almost everyone knows someone who has been severely impacted by COVID. I think roughly, a population in Coles County of 48,000 or so, I think 1 in 280 have died from COVID. And so it doesn't take much for a church community or a school community to know someone now who's passed away. But even despite that, I think our vaccination rate in Coles County is only 47% right now. So a push for those, we can still do better getting vaccinated, and there's a new vaccine that's going to be coming down the pike, hopefully in the next few weeks. And an updated one, just like the flu, sort of one more tailored. So we're going to be having those discussions with patients again in a push for another vaccine.
Well, just to give you the floor on vaccination, again, in news, I hear all of it. I hear both sides, and I have to admit that there's been a little skepticism just between the folks who have maybe gotten the vaccine and they still got COVID, or they didn't get it as badly, or things of that nature, or why they need to continue to get the boosters. Can you kind of walk us through that explanation, why that's so important?
So he doesn't have to work so hard.
Well,
yeah. So
very true.
But
it's staying out of the ICU.
He can't drink any more coffee.
Exactly, and that's the key. And I think the message initially was, wow, these vaccines are so effective. They're like 94% effective at preventing getting the disease.
Yeah.
And that was true very early on with the first set of, first variant that we had. Now it is extremely effective. It's just extremely effective at preventing severe disease. It's extremely effective at preventing someone from coming to my ICU. It's not so effective at getting the disease, but ultimately, from a medical standpoint, I mean, that's not the big outcome. I mean, the big outcome is death, and it is highly, highly effective at that. And so I think, but again, it's a message early on was that these are preventing getting it.
Yeah, I won't get it. I'm safe. And so it really threw people off.
And now the message is, well, you may still get it, but the risk of death, it drops dramatically.
Yeah, I think we all have data of our own hospitals and systems, but now we have a lot of people. We have a lot of people in the community getting infected, and various symptoms out there in the community. We have still a pretty good number of people in the hospital, but they're not in the ICU. Mm-hmm. They're not being, in 5 days going from a positive test to they can't breathe, they're on a machine, and then they wind up dying. That's what was before vaccines. Now it's better because of the vaccines.
Sure. So for people who are concerned or have heard rumors, seen headlines about vaccine injury, what kind of data are you getting on that to kind of help put them at ease?
It's a story that's still not fully told, of course, because again, we move quickly. And I know many people question the mRNA-based vaccines. Fortunately, we just have approval for yet another vaccine. The Novavax vaccine was just approved, and that's a different type of technology. So there's choices. They all seem to be exceptionally safe, and they all are highly effective at keeping you out of the ICU and keeping you from dying. So, for folks that said, well, I don't want Pfizer because it's mRNA, well, now you've got some choices. And the only one that still has some significant warnings and are only to be used in limited circumstances is the J&J vaccine at this point. But the others have an incredible safety profile.
I think leading into the scientific method, we don't have years of data. We have a couple years now, but not decades of data on these vaccines. But the amount of the millions and millions of people who have gotten a vaccine, if things were to happen, like if in 5 years something were to develop from that vaccine, we would know that now because of all the millions of people getting the dose. It's not an experiment to get the vaccine, but it's really an experiment in seeing are things popping up? Are people suddenly dying? Are people having heart attacks? Are people having other problems? And we're not seeing that. What we're seeing is that in the US, we've saved hundreds of thousands of lives by using the vaccine. And like I said, people aren't coming to the ICU, they're not dying like they did before.
So we've got a couple of viewer questions coming in. First, if I've had one booster, when should I get the next one? Or should I have already had one? What is our vaccine schedule at now?
So yeah, I think the definitive recommendations for this newest booster that we anticipate to be coming out is not yet there, but I think the thought is that it should be 2 months. You should get the newest booster that'll be available 2 months after your last booster. Mm-hmm. And so if you just recently have gotten a booster dose, you should wait 2 months before you get the new updated Omicron-focused vaccine. So that's sort of, I think, what's coming out, but that has not been officially stated
and most
yet.
of the pharmacies have paused and physician offices paused giving the other vaccine in the older vaccine in anticipation. And there are a few of the health departments that already have access to the bivalent vaccine, so it's out there in limited quantity at this point. But yeah, 2 month interval and especially high risk groups. I mean, once again, it's always a risk benefit conversation, but high risk groups, which unfortunately I'm 50, so I'm in.
We're like others, we're going to make it easy for people because we'll have the bivalent vaccine at the same time you get your flu shot. So one in each arm, you're set to go.
So bivalent, is that
So
whichever?
Thanks for pointing that out. I'll define it. So the new vaccine, the previous vaccine was for one strain, the original strain, the original S protein, spike protein that was on the original virus. Now they have one for both the original virus and also for the Omicron or BA.5. So it's two different variants of the virus in one vaccine. So it's called bivalent.
Gotcha.
Very similar to the flu shot.
Yes.
Most of the time the flu shot has more than one strain in it. I think this year's might even be quadrivalent.
Yeah, I think it's 4.
Yeah, there's 4 strains in
They'll
this
cover
year,
you
so-
real good.
Yeah, we sure hope.
Hopefully.
And a follow-up question before we take a quick break. So as we are talking about getting the boosters and things of that nature, you just said that you could get it at the same time as your flu shot. Is there any need to wait if you are having any sort of other medical treatment to space them out?
No. Some of our surgery colleagues might say maybe wait until after your surgery. So in case you have a side effect ahead of time, if you're sick, we might not do surgery. So don't mess with the possible side effect. But medically speaking, scientifically speaking, there's nothing that that would prevent you from getting that vaccine.
And when you're talking side effect, you mean if I'm feeling sluggish, the fever that's brief, those type of things?
Exactly, yeah.
Gotcha.
Because you're revving up your immune system.
And it's going to work.
That's right.
It's going to protect you. Wonderful. Well, you all are doing a fabulous job. Thank you for answering our questions. We're going to pivot and take a quick break, and we will be back in just a moment. But again, if you have any questions, please call in. The number is 877-727-9348. We'll be right back.
This is the PBS Video app. Install it on your phone, tablet, smart TV, or other streaming device, and use it to access more of the PBS shows you love. But if you're looking for even more shows to binge like this, or early access to shows like this, then look for this icon. That's the Passport icon, and it means that video is part of Passport. Passport is our way of saying thank you to our station members. Donate to your local PBS station today, and one of the member benefits you'll receive is Passport, which offers extended access to a growing library of favorite PBS programs. You can support your station and your community by becoming a member today. Visit pbs.org/getpassport for details. Watch Passport anytime on any screen, wherever you stream. It's your ticket to the best of PBS.
Your entertainment options are endless. They're on demand and everywhere. But we're WEIU, local with purpose, producing programs with fresh perspective, building connections through shared experiences, sparking curiosity by engaging education. Just as you enjoy WEIU today, and we hope every day, you make it possible for tomorrow. Invest in WEIU.
Be with us for a new season of the Paw Report. We travel to the Douglas Hart Nature Center to talk bugs, and local veterinarians join us in studio with information on pet anxiety and dermatology. But that's not all. Our viewers have some favorites, so we're bringing back a few Paw Report classics too. The Paw Report, Mondays at 7 on WEIU.
Your favorite fall shows are coming back to WEIU, including Season 15 of Being Well. Tune in every Tuesday night at 7 to hear from your local medical professionals as they talk about the health topics that matter to you. It's Season 15 of Being Well, right here on WEIU.
City Spotlight, covering communities in central and southeastern Illinois since 2015. From Danville to Taylorville, Decatur to Newton, and places in between. City Spotlight talks with community leaders about what's taking place in their local communities.
Wednesday at 7 o'clock on WEIU.
Welcome back. You've got us for another half hour here for Being Well, the Pandemic Panel Live. We would love for you to call in with your questions for our panel of doctors here. The number is 877-727-9348. We will throw it at the bottom of the screen for you. We've got phone operators standing by waiting to take your questions. As we come back from break, we've got a little bit of a question from Jeff. We've got, what are some reasons someone would still be wearing a mask now that it's not mandated?
I'll take this one.
Don't fight over it.
Yeah. I think that I think the way to address that now is everyone has to think about themselves and their own personal risk. So if someone feels that they're going to have a worse outcome if they get the illness, they might take care of a sick loved one at home. They might have young children at home. They might themselves have comorbidities that aren't visible. But if they feel like wearing a mask, that's fine. Let them wear a mask and let them be protected. Others might not, because their personal risk, they view themselves as not at risk, or they'll only get a mild illness because they're vaccinated. I think we need to have room for all of those varieties.
I think the one to add would be somebody that we have an awful lot of medications these days that modulate the immune system. Mm-hmm. So everything from psoriasis to inflammatory bowel disease to, and so we use a lot of medications that modify the immune system. And those are folks that, they should at least consider their own risk.
And I think to add to that just a little bit, they've sort of become a little bit smart about sort of the environment. We talk about prevalence when the virus is more prevalent in the community, much higher spread, it's much more active. Then when you're in settings where you're closer and more confined or indoors, you may not normally consider a mask, but that may be an increased risk of transmission. And so I think at times when the virus is hopefully very low, it's a lot safer to consider being without it. So I think we all have to kind of become kind of better consumers and advocate of the information out there to have all the information to make the best risk assessment for ourselves and those that we can potentially expose.
And for some, it's a continuation of a practice that actually was one of the major protective factors against depression and anxiety. Those who stayed very tightly to the regimen that was recommended actually showed much less signs of deteriorating mental health. So in some ways, it actually is an enhancement of mental health. So it may be that the individual in question is continuing something that's worked very well.
Definitely, and I think you bring up a great point that in a time where there was a lot that we could not control, you could control your own mask wearing, your own PPE, your social distancing, and just kind of trying to make the best of a situation that was so turbulent.
The other thing is if you come visit us in our offices or the hospitals or clinics, you'll see us all masked because we're still required to there.
Even though we miss your smiling faces, it is for a good cause.
That's right.
For folks who had collected PPE during the height of the pandemic, is it good to hang on to those? Are they okay to pitch them now? What is your recommendation?
Most of the standard
get out your crystal ball.
But most of the standard, like just barrier type masks, are going to not necessarily lose efficacy. Yeah. We learned a lot though about the high level respirators, so the N95s and things that everybody talked about, and really found out that they last a lot longer than what we thought, and they're still very effective. So, I wouldn't get in any hurry to just fill the landfill by any means. I think the jury's still out, but we definitely had a very large social experience or hospital-based experience in extended wear and extended use of masks, and found them to continue to be very effective.
I think if you have cloth masks, I think you could view that as something that will protect others from you. So if you have symptoms of a cold, the flu, or COVID, and you wear a cloth mask, that'll help protect you from sneezing, coughing into the environment. A surgical mask, I think, is effective and can be helpful even to protect yourself. And then the higher level N95s will certainly protect you. And I wouldn't get rid of anything right now. And I'm not saying there's anything coming down the road that I know of. But that feeling I had back then when we didn't have the masks, I wish we did, I'm not going to I'm not going to toss any.
Right. Another question that we had come in, it talks about long COVID, which I know you said we're still learning a lot about. Can you try to explain a little bit of what the difference is between long COVID and just having effects left over? Is there a difference? Or is it all the same thing?
I think scientifically, it's really important to define what that means. And for most, it's that you have some lingering symptoms after 4 weeks. Most people, when you get sick, you'll be sick for 7 to 10 days, whatever your normal course is. And maybe you're not back to normal yet, a few days after that, but by 4 weeks, you'll be over things. What we're seeing with long COVID is a lot of symptoms lasting longer than 4 weeks, into months and now years in some people. That's how I would differentiate whether I'm sick and just getting over it, or I might have something such as long COVID where I should talk to somebody about it.
And from the mental health perspective, what we've learned from prior disasters, pandemics, catastrophic events of all kinds, is that the mental health impact lasts longer than any other impact. So that's to say, we don't know what we're going to be facing with the long-term impact on psychological issues. We know that it's not going to make anything better. And I am concerned about increasing rates of PTSD, continuing increases in suicidal ideation, and that's why social connection becomes now of paramount importance. And hopefully, if there's one thing good that's come out of this, it's more people really seem to understand the importance of family, intimacy, friendships, and actually some altruism and empathy on people outside their normal network. So hopefully those will be protective factors. But we have no clue what's down the road in terms of long-term mental health impact.
Does anyone have anything to add before we move on? We've got a guest or a viewer question from Betty in Effingham. What oral medications are available for high-risk patients who get breakthrough COVID, such as prescriptions, vitamins, etc.?
I can't pronounce them.
I think in general, there's 2 oral medications available for COVID for those who are at high risk, a risk of being hospitalized, being in the ICU, or death. Paxlovid is the one that's most commonly used. And if you're at high risk, which some of the studies show probably 65 and over for sure should consider themselves high risk, and other people with other comorbidities, Paxlovid taken within 5 days of your symptom onset can really help you to avoid getting really, really sick.
And available for free. So at this point, those medications, if you see your provider and they prescribe them, they're at no cost. And so definitely something worth looking at, again, with the goal of not having to go to the hospital.
Right. So getting tested early if you have symptoms, and then contacting your healthcare provider if you are positive to see if you're a candidate is a great idea.
And I think to add to that, I think the pharmacists can prescribe it themselves without necessarily seeing the physician. So if that's a barrier to not having a physician or whatnot, the pharmacist can help you work through this and can prescribe it without a physician's signature.
All right, we've got Susan from Ashmore. Her parents received the first and second COVID vaccine as well as the first booster. However, they missed the opportunity to get the second booster in time. Should they get the new vaccine for the Omicron or the second booster? They both used Moderna.
Wait.
They should get the bivalent,
new
vaccine.
Yeah.
So everyone who's not been vaccinated yet should get 2 of the mRNA vaccines from the original bucket, the original vaccine. Mm-hmm. And then everyone now who's got their initial 2, if it's been at least 2 months, should get that bivalent vaccine for a booster.
And if it's the second boost, you still would want, if you're in a high-risk group and you need a second boost, you would want to wait. And indeed, most places have stopped even administering the other boost.
Gotcha. Another question coming in. O-negative blood type, not getting symptoms. Have you all heard anything about that? Any truth to that?
I think there was some, there was some thought early on that O negative maybe was a protective factor from severe disease. I don't think that's been borne out, but that was something that earlier in the pandemic was discussed. I remember my daughter reaching out to me asking, because she's O negative, does she have to worry as much? And I said, you still need to socially distant and you still need to wear your mask. So you're not.
I'm O negative and it was not that much fun.
Yeah. Another question we've got, how would panelists explain increased level of sudden death syndrome correlating to increased levels of vaccination in the public?
I think, go ahead.
I think that's a tough one. I mean, there's a lot of associations, especially when you start working with large numbers, teasing out actually cause and effect and confounders. It becomes a little bit difficult. I think, you have a lot of people getting COVID, a lot of people getting vaccines. There's a lot of incidents of different diseases popping up. People develop heart attacks. I mean, there's just a normal rate that goes on in the public with that. If you take a look at all the people who now develop coronary disease or are found to have coronary disease but have all been vaccinated, you can potentially look for this association. I think we have to wait and again have some more time to really get good numbers. But we're even better now where we are than we were at the beginning. I just want to phrase, a lot of people were saying we don't know about these vaccines. They haven't been well tested. The initial studies had like 60,000 people in them. As you mentioned before, we're at millions. I mean, hundreds of millions of people have received these vaccines. And again, they are extremely, extremely safe. But when you give hundreds of millions of vaccines, you have hundreds of millions of people who are living life and getting illnesses and suffering different disease states. And so the idea that people are having sudden death, I mean, there is a certain amount of that happens in the community at large. So I think all of us want to be very wary because we don't want to be absolute, but I think I'm wary of the concern of those numbers right now. We just really haven't felt that, I think, in the medical community, that there's this increased risk of death with these vaccines.
I think that you put it very well. I think it's not something for us to ignore. If we're looking at all this data and there's a lot of noise in the data. Like you were referring to, there are people that will die today. And some of them got vaccinated within the last week. But whether that's cause and effect, you need to study pretty hard. You can't just say, because that happened, there's a cause and effect. So I think we have to be aware of it, and if there's something that does come through from the data, act on it. But in my mind, someone worrying about sudden death from the vaccine now is I don't want to minimize that. It's obviously an important thing we need to keep track of. But for the last 30 years of my practice, I've had this discussion in the fall with my patients. They come in and say, I don't want the flu shot because last year I got sick after I got the flu shot. I know that the flu shot can't give you a viral infection. But I also know that very many people get viral infections in the fall. So they would get their flu vaccine, and then within a few days they would get their illness, which they would have gotten anyway, but in their mind it's connected now. And it's hard, as humans, it's hard for us to separate that. That seems like cause and effect where it might not be.
Mm-hmm. And we've all talked earlier that it's going to take years before we really sort out what do the consequences of all this look like. And the mental health aspect of it, enormously so. I mean, you get a period of resilience and people rally and they can get through anything, but then that takes a tremendous toll, and then there's an afterwards effect that we don't have a grasp on yet. So I think it's a great question that just time's going to tell us.
Yes, and thank you to Andrew from Charleston for that question. And as we're talking about mental health, let's dive into that just a little bit. There's been several groups of people who feel as though they have missed major milestones, whether that be a high school graduation or a prom, pushing back weddings. What types of things are you seeing or people talking about? Or maybe they're more serious than pushing events back.
There are kids and parents for whom missing proms, graduation ceremonies. In Paris, for example, there's the first Friday every May is a major celebration for senior girls called May Fête. missing those events for the people in 2019 and 2020 was a major loss, and actually felt as being robbed, cheated, if you will. So not only was there the sadness, but there was some anger and resentment. And that's why and I know a number of school systems have really done a good job of trying to come up with some way of compensating for that. And kudos to them. But it's a real issue, and for those who lost that, it's not something that you can get back. So it's a profound loss.
And for those of you, since you are all in the health system, I mean, what has the mental weight been to not be able to escape this information, to escape COVID chatter? I know that here at WEIU, I helped with the news program for the first couple months when our students didn't come back from spring break. And to come in, you talk about COVID, you go home, you talk about COVID. That's a huge weight, and then you are all seeing it firsthand.
I think again, to the comment earlier, initially there's just this incredible rallying of the human spirit. And healthcare workers were phenomenal. I mean, not just doctors and nurses, the folks that come in and help us make our food and prepare the cleanliness of the facility to keep it safe. I mean, how critically important was housekeeping during this whole thing to keep things safe? And folks rallied and came and just went to the cause. And now, as it's winding in some ways down, the exhaustion is enormous, and when we saw lots of people leave the profession, whether that was truly clinical profession or even just get out of healthcare, and they got away from the organizations as a whole because they're worn out by it, and we're still paying the consequences. Now, hopefully, there's a generation of new folks coming in that are excited about it again.
Yeah.
But I think, as you stated very early on, there was a rallying. There was sort of seeing everyone come together. That was very uplifting and inspiring. But I think, as we've talked about here, initially with concerns of masks and then the divisiveness with vaccines, the medical community is just, as people living in our communities, have opinions about that too, and that kind of crept into the hospital space. And everyone kind of working together, there became this tension of us working and not all being on the same page. And that just made things much more difficult as sort of the fourth wave and the most intense wave came through. And I think we are going to be feeling the repercussions of that, as we talked about, with a lot of people exiting healthcare. And the pipeline to replace, I mean, there's a lot of talent and knowledge and wisdom that just left and is leaving, and it's not easy to fill quickly. And we're going to be struggling with this in all aspects of medicine for quite a while.
I think that's one of the things that will take us years to know, what's really happening right now. We know people are leaving. We know the great resignation occurred among all of us, not just healthcare. But I think, 5, 10, 20 years from now, we'll realize how profound this last couple of years has been. And I think we'll also realize we're still in the midst of it. Even though we like to think it's behind us, we're still in it right now. And it's just going to be very interesting to see what changes in society there are, what changes in healthcare there are from this profound event.
So the narrative was pretty big for getting a vaccine developed. Did that overshadow the efficacy of natural immunity? Did they look at natural immunity? Did that kind of get pushed to the wayside just for some folks who maybe it did feel like a cold? Or
Again, the risk of natural immunity is that you still are at risk for death and severe disease.
The proofs in the hospitalization.
Yeah.
And the vaccine, again, a different type of immunity. And actually what we understand about it is that actually the immunity you get from the vaccine is a little bit more breadth to it than getting COVID itself. You tend to have a very strong immunity to the strain you got infected with. But the vaccine tends to be a little broader and has really been more sustainable through a lot of the subvariants that maybe if you had an early infection to one of the earlier variants, you have really almost no protection with the natural immunity. But again, can't stress enough, the vaccines prevent death. I mean, that really is a key take-home message. I mean, it prevents death, and that's not something that natural immunity can do.
I think when the Omicron surge happened last year, there was data that came out that said you were more likely, if you got infected, to get long COVID and to wind up in the hospital, ICU, and die if you didn't get any vaccine. If you had a previous variant or a previous infection, that was a little better than no vaccine at all. And then best was having the vaccine. So the science bore out that natural immunity is important, and it's something, thankfully, we all have. We're living because of that, but it wasn't enough for this virus.
And since you bring up long COVID again, for someone who's experiencing long COVID, including fatigue and hair loss, do you have any recommendations?
I think contacting your health provider, your primary care provider, and getting in and talking about that. There are clinics set up looking specifically at long COVID. I think the important thing now is for us to gather the data. So you going to your provider and saying, I have hair loss and fatigue, there might not be a lot we could do for you now other than just general health, but at least we'll know that might be that's in the category of long COVID, and in the future we might be able to impact that. Something
that can be researched and tested on later.
Exactly.
Keep learning.
Exactly.
I would caution hair loss.
Yeah.
Truly, Doc can testify to this as well. After any significant illness, and pregnancy is a classic example, although it's not an illness, the body goes through a period of time where it will pause hair growth, and so then you have your normal hair loss, and so you lose a ton of hair. That's called telogen effluvium. It's usually self-limited. So I wouldn't put myself in the bucket of long COVID right out of the gate. If my only symptom were hair loss, I'd wait, especially if you were sick. If you were really sick with it. That's a pretty normal phenomenon.
So as we are looking toward the fall, crystal ball edition, you knew the question was coming. Is there any data or inklings coming out about what the forecast might be for COVID? I feel like we do that every year with the flu. And is it cold, flu, and COVID season now?
We don't know. I think if we can look at the last two falls and just in general with viruses, when it gets colder, we kind of cluster a little bit more. There tends to be an increased frequency. The aberration was when we were all wearing masks that actually saw a tremendous decrease in a lot of these other viral transmissions. But I think we can expect to see some sort of uptick, hoping that the combination of vaccines, natural immunity can kind of help mitigate transmission and spread. But I think we're all holding our breath and crossing our fingers.
Maybe a follow-up, how will the flu season be this year? We do have evidence there because it's winter in the southern hemisphere and it's their flu season. And Australia has been hit pretty hard by flu or influenza this year. So there's indications it could be a bad year this year. So one more reason to get your influenza vaccine.
In our last couple of minutes here, refer back to another viewer question. Her neighbor's blood type is O negative. The neighbor was diagnosed with COVID, but didn't know until they had their blood tested. Their question is, what do the studies look like for people with different blood types in their reactions to COVID? So is any of that data out there?
I think small amounts of data that were interesting and piqued our interest early on, but I don't think those, as we looked at larger groups, I don't think it bore out as well as those early studies did. But it's something that we might know a year or two from now, that there was a variation in if you had a different type of blood type. But as you said, you were O negative and got hit hard.
I'm a personal example of not protected purely by blood type. So.
Well, we definitely appreciate all of your time this evening. You've made for a fabulous show. We had a lot of great questions come in from our viewers, so we're very thankful for that. If you'd like to watch this episode back, you can find it on the WEIU-TV Facebook and also YouTube page. And as we are closing out this evening, we hope that you will join us for our new season of Being Well. It starts next Tuesday night at 7 p.m. And for WEIU-TV, I'm Lacey Spence, and have a great night.
Carle is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carle, with Health Alliance, is always at the forefront to help you thrive.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
They're the ones who raise the bar. The ones dedicated to providing care in the most demanding of circumstances. The ones that understand the healing benefits of kindness and compassion. They're the people of Sarah Bush Lincoln, and they set the bar high. Sarah Bush Lincoln, trusted, compassionate care right here close to home.